Hi everyone, welcome back to our channel. My name is Jade, I'm a fourth year dental student, and this is
Dr. Rhona. You all know me from my YouTube channel as well and my social media channels.
Principal Dentist of the Chelsea Dental Clinic. And today we are going to be talking about how to deal with burnout at uni or at work.
Yeah, and this is a subject that's really close to my heart. A few months ago, I did a video with Shadi. It's actually on my YouTube channel, and I talked about mental health in dentistry. I exposed something that most dentists are aware of, but not the rest of the public, that dentistry has one of the highest suicide rates of any profession. And it's something that's really, really, really sad, really terrible, and actually not much is being done about it. After I did that video, a lot of people said, okay, great, you've enlightened us with this information, but what can we do about it? I want an answer. So Jade and I are going to shed some light on our top tips on how we can deal with burnout. She's a student, I'm a principal, so there's different elements to what we've both been experiencing.
Absolutely. Okay, so to start off, I'll talk about my first experience of burnout, and I think it happened during my second year of university. I was trying to juggle so many different things at once, and I started getting overwhelmed. So I had dance, I had work, I was trying to build a social media presence, and then I had my studies on top of that, which I really do value, and I do try and do the best that I can, but it was becoming too much and overwhelming. So I started experiencing a lot of tiredness, fatigue, low moods, and just lack of, I guess, motivation to try and do well. And my experiences of burnout, it seemed to last forever. At the time, I think it lasted maybe two months, and I started, I guess, losing weight a bit. So then I went back to my mum's house and everything got better. Going back to family, surrounding yourself with good, supportive friends was great for me. But it was definitely a period of time that when I look back at it now, I realise, okay, I was burning out. But in the moment, it was just...
Lack of motivation. Yeah, well, it's really interesting because I think that burnout can manifest in lots of different ways. And if I'm completely honest with you, I can't pinpoint a single time where I'm like, okay, this was just the only time I was burnt out. In fact, for me, I think it's happened across my life various times. I think, putting a lot of pressure on myself to get into dental school, I experienced burnout because I was really pushing the boundaries with like revision for exams and then trying to maintain a social life as well. During university, I had a lot of energy actually during university, so I felt like I was doing a really good job of, getting the work done, having my social life and so forth, but I think I definitely felt just more stressed out. However, in my working life, burnout manifested several times, and it actually started to manifest, I think, after hitting the ground running for so many years. I think for me, what happened is that my body physically gave up on me. Okay. So there were just like symptoms, for example, where I would have anxiety attacks, where I just couldn't breathe properly, or I would get severe muscle ache. I had days where I was so clouded. I then just got ill, flu-like symptoms, really, really feeling like I was going to catch a cold. And then I'd recover, and 2 weeks later, I'd get these flu-like symptoms again. And it was my body basically telling me that I was just working too much, trying to do too much, and not resting enough. However, I think the last couple of years, I spent a really long time focusing on how to deal with that and really understanding my body and learning to say no to these things, which we're going to go into later on. But yeah, is there anything else you really want to shed on your story, Jade, before we move on?
It's so strange because the way our bodies react to how our minds and our mentals are feeling is so powerful. Like, we need to make sure that when we're thinking about our work, our studies, our school, we're also looking after our bodies and then our minds, because the two are so interconnected.
Totally. We have shared our experiences of burnout, and for me it's an ongoing thing. However, I realised when I got COVID last year, and I did this whole video about long COVID, that I couldn't continue the way that I was going because I was going to collapse and I wasn't going to be able to run my business. So I really had to find ways to cope with the burnout and to ensure that I was leading a healthy lifestyle, for myself, my team, and my patients. But Jade, I'm interested to know, before I share my top tips on how I've dealt with it, what your top tips are as a student.
So for myself, it's definitely joining an active society. So I am part of Dance Society, BL Dance, and we're a small group. And it's so good because when you're dancing, you're exercising. It's also stimulus for your mind because you're expressing something. I do ballet, contemporary, and jazz. So those are three different styles of dance. So I can be emotional in one, fun in another. And it's just that outlet, that physical outlet that allows you to just refresh yourself.
Amazing.
Away from the library. It's great. So that's my first and foremost one. Maybe the gym for some people.
Yeah.
If dance isn't one.
I can't dance to save my life. Wait till you see some of the TikToks that are going to drop.
we're gonna do that. It's gonna be good.
So I think for me, one of my major top tips are also physical exercise. I don't care what anyone says. You don't have to be a gym buff to go, but you've got to release that energy inside you in some shape or form. So even if it's not gym for you, for me it is the gym because I love the gym. It could be running, it could be dance, as you've already mentioned. It could be yoga, it could be Pilates. You know, there's so many different things, but getting your body moving has been proven to show that it really does release endorphins and make you feel good. So physical exercise for me is one of my holy grails in the morning, almost every morning. And even if I'm not exercising, I walk to work, which takes me about an hour. So even walking is good enough.
That's good. That's really good. And it wakes you up.
100%, 100%. And honestly, I actually get in a bad mood now if I'm not doing exercise.
Okay.
So what's your next top tip?
Next top tip will probably be about diet. So when it comes to food, it's nourishing our body, also nourishing our minds. And so for myself, when I would be experiencing burnout, I'd sometimes forget, lose my appetite. I wouldn't monitor things. So making sure that you have a set timing for your meals. Sometimes you can't make them, but a set timing for your meals to make sure that you prioritize that so that your body is getting the nutrition.
Yeah.
And then having meal plans sometimes. It can be as small as saying that, okay, I need to eat one piece of fruit every single day because it's baby steps.
So nutrition for me, I think, is a really important one. I'm really lucky because my mum's a nutritionist. So whilst everyone else was having like cheese strings back in the day and all those sorts of snacks, I used to cry like cheese strings and Baby Bell, and I'd be sent to school with carrots and hummus, you know. And I'm really grateful because my mum definitely instilled lots of healthy eating habits, and I actually crave healthy food. But again, healthy food makes you feel good, you know. There's just so much science behind it. You know, if you have brain food like nuts, avocados, you know, all the healthy fats, it's going to nourish your brain. If you're having things like vegetables and fibers, you know, it's going to help your digestive tract. So I would definitely agree with that. One other massive thing that's helped me, and it's going to sound really cliche, is journaling. So I've got back into the habit of this. So every single morning when I wake up, so I have a bit of a morning routine actually, and this is what I do almost every day. And if I don't, this is when my body is out of sync and out of balance. So I set my alarm, and then what I do is actually I put on some meditation music for about 3 to 5 minutes, and I do deep breathing exercises, and I've only started practicing in the last few months, and it's really helped me, you know, really taking those deep breaths where you're going deep into your diaphragm. There is a guy called Wim Hof, I don't know if you've heard of him, and he does this like crazy breathing. He's also about like freezing cold showers for 2 minutes a day. Yes,
I'm not there yet.
Yeah, okay, you're not there. Yeah, nor am I, hun. Like, we're not English, so we can't deal with the cold, you know. So there's a guy called Wim Hof that talks about all of his experiences with being in the cold and how beneficial a cold shower is. I'm not there yet, but he talks also about breathing and so forth, and his breathing exercises have been shown to help the brain get into like a state of like calm and euphoria in some cases if you get deep enough. So I do my breathing exercises for 3 to 5 minutes. Then what I do is that I get up and I will journal for about 10 minutes. So I will write down my intentions for the day, how I'm feeling, what I'm worried about, having a sense of clarity. And then it's not until I've done all of that, brush my teeth, that I will look at my phone, because I found that looking at my phone first thing in the morning gave me more stress. And delaying all of that till I left the house has massively helped me. So this is all before I go to the gym, and then I go to the gym, and I find that morning ritual is really what just helps me stay on track and helps prevent the burnout. That's the morning ritual for me. Any other top tips from you?
amazing that you said journaling, because what I do is kind of it's like a side thing to journaling, where it's gratitude writing.
Yes, love it.
So every night before I go to bed, I need to say something or 3 things that I'm grateful for. Usually my family and friends are in there, but it's just small things in the day that they kind of romanticize your life. So things that you're grateful for, and then the next day you'll be looking for the next thing that you're going to write in your gratitude journaling. So definitely that.
You'll be in my gratitude list today. So there you go. So 100%. And and I think the thing is for me as well, it's having balance and learning to say no. So when you're in the position of being a principal and recognizing that your time is really limited, I will say no to things that I feel won't give me happiness. You know, I think people think that saying yes to everything is like this badge of honor, like busyness is a badge of honor.
That's what I struggle with right now.
It's okay. And you know what, I was like that as well. But the thing is, it's about learning that. And I think it was like, I can't dedicate my time. So providing that I have enough time to socialise, because it's a massively important thing to me, spend time with my family, do things like going out and partying, because I love that as well, and ensuring that I'm treating my patients, I have to say no to things. So if I don't want to lecture for a certain company, for example, if I can't do certain extracurricular activities, I won't. I don't say yes to breakfast dates with people because I want to go to the gym in the morning, and that's more important to me than having a breakfast date, for example. So I think you need to work out what really makes you happy and start saying no to the things that don't. And I also take one day off in the week, which is my Fridays, hence why we're filming. And my Fridays are really dedicated to parlour and also just, you know, looking after myself. So like getting my hair done, getting my nails done, because self-care is so important. It's not selfish. It actually shows that you are honouring your body.
Most of the time it's selfless.
Exactly.
When you're in a good mindset, you're good to other people.
100%. So is there anything that you want to touch on or anything else you want to ask me?
Perhaps about therapy and how it might help someone come out of their rut or their burnout, and how, if you've ever used it.
So I'm very open about mental health as well. So kind of taking a little bit of a tangent, I think that therapy is wonderful and there's no shame in investing in therapy. I have been to many therapists, in and out of therapy for the last 10 years. And the reason is because there are moments in your life where you need guidance and clarity, and that has to be from someone that's not friends or family, because it has to be objective and it has to be something that's not influenced by someone else. So I think there's no shame in it. You know, if people have a physical ailment like a broken arm or a broken ankle or something like that, they'll go and see a doctor. Exactly, a dentist. But if you have something going on in your mind and it's just so noisy and so clouded, and you have days that you feel like you really just can't get on with it, investing in therapy is a really great way to help get better. And I found that, you know, having a therapist has helped guide me. I've even gone to therapists when I'm in a really good mental space and really happy, because they keep me on the right track, you know. And I think that investing in the right one is really key. There's lots of different modalities. You know, you've got people that do CBT, there's people that do trauma work, there's people that are specializing in like family stuff. So you've got to work out what's important to you. I believe there is a website as well to find therapists. I would always go for somebody that's qualified, look at the work that they do, and, you know, give it at least a month, because it's really hard to like someone to get into your psyche and your brain, you know, like immediately, and you might feel like this isn't working for me. Like, why aren't they telling me what to do?
Absolutely.
They're not going to tell you what to do. They're just going to guide you and find out what's going on in your mind. And if you feel it's not a right click after about 4 to 8 weeks, then I consider moving on to someone else. Okay. But for me, it's a real great investment into your mental health.
Thank you for that. That's great.
It's all right. I like to be honest, as you know. So I think that we've covered quite a lot today between us. We've talked about nutrition and how important that is.
Exercise and how important that is.
Talked about journaling as well, and gratitude lists, and how that can impact your daily life and the way that you feel.
As well as therapy and how to shop for the best therapist for yourself.
Exactly. And the other thing that I would note as well is sleep. Sleep's really important. I try to aim for 7 hours or more. These people, again, they're like, I need 3 hours and I can do so much in that time. I'm sorry, but Margaret Thatcher died because she couldn't get enough sleep as well. And that was really important. There's so many people in history that have shown that sleep is important. It can actually affect the longevity of your life. So again, not getting sleep for me is not the kind of cool thing to do.
I didn't know that.
Yeah. So that's a super interesting one as well. And meditation, and just having that calm and clarity and saying no to things that don't really serve you.
Of course.
Yeah.
Thank you so much for watching our video. We hope you enjoyed it. Please do like and subscribe to our channel. Other than that, thank you so much for watching.
See you later.